Hi, my name's Dave Stern, and I'd like to introduce you to VelociDoc, the urgent care doctor's best friend. Back in 2002, we owned 6 urgent care centers, and we went and looked at all of the EMRs that were on the market to see if any of them would work in our urgent care centers. Unfortunately, we came to the conclusion that no EMR on the market was efficient enough, user-friendly enough, captured coding properly, and captured revenue properly in such a way that it would really work in the rapid pace of an urgent care center. And so we designed the VelociDoc EMR, the #1 rated EMR for urgent care in every survey ever done. I'd like to introduce you to VelociDoc here specifically by taking you to the History of Present Illness tab. The History of Present Illness tab starts over here in the top left-hand corner and allows me to see what the chief complaint is and the history of present illness is. The Review of Systems tab next allows us to document the review of systems. The Past Family Social History allows the staff to easily document the past family social history. Based on the chief complaint, the Exam tab will default here to an exam, in this case, because the patient's chief complaint is back pain, an exam that is specifically designed to allow the physician to document that body area. Then we move over to the Assessment and Plan tab, and there already are the diagnoses that are frequently associated with that particular complaint. If we want to order an X-ray, we're integrated with many of the X-ray systems, and also we, through an integration with Teleradiology Specialists, allow you to get the actual reading of the radiologist directly into the EMR within a few minutes of ordering the X-ray itself. If I want to order a back X-ray, I simply go here, pick lumbar sacral spine, and add that on. And there's the reading. So I've ordered an X-ray, and out here on the tracking board, which we haven't seen yet, on that tracking board, you can see lumbar sacral spine X-ray is ordered on that patient, and it's in red. Red indicates the test has been ordered, but it's not yet performed. When the radiology technologist comes into the chart, the radiology technologist simply has to say ready for reading, and that turns the tab in the chart yellow. Yellow indicating it's ready for the physician. Out in the tracking board, everyone in the clinic can see that the lumbosacral spine X-ray is yellow. The order is yellow, meaning it's ready for the doc to read it. The doc goes in and reads the film and then simply documents here that the X-ray, for example, in this case, is all negative. No fracture, no dislocation, joint spaces are well preserved, and so on. That's as simple as it is to order an X-ray. Over here on the assessment and plan, I can just pick the diagnosis, in this case, LS pain. No workup plan, prescription drug management. We'll give an exit care for back exercises. Here we go, back exercises. And we'll say recheck in 3 days, if not better, sooner if worse. The patient wants a work note, and we'll give the patient a note saying that they can be off work for a day or two, and back to work there in 2 days. And we've completed this chart. The only thing left for us to do is to order some medications, and we can order medications simply by launching the prescription window and prescribing a specific medicine for this patient. In this case, I'm going to go the drug set compounds, select back pain as the problem, prescribe both medications with a single click, and then simply review those orders and transmit to the correct pharmacy. Just a few clicks, we've now completed this visit. Hopefully that shows you how easy it is to use VelociDoc. Let me show you one other aspect of the system that is particularly easy to use. So let's say you see a patient with a non-displaced fracture of the medial aspect of the right clavicle. You say, wow, that's going to take a lot of work to do the ICD-10 coding. I'm going to have to do a lot of searching and parsing through different codes. And the answer is with VelociDoc. If you're a good clinician and you can answer a few questions that VelociDoc will ask you, you will be able to code that in seconds. Let's see how hard it is. Let's go here to the fracture tab. All the fractures that you can find are basically found here. We'll pick the clavicle, and we'll say here that it's non-displaced, and it's the initial encounter for the closed fracture. That's all it took, and we have the code for that particular diagnosis. Over on the code summary page, we can see here that we have a non-displaced fracture of the sternal end of the right clavicle initial encounter. Simple as that. We got that complicated code with just a few seconds of work. So if you want to see why VelociDoc has been consistently rated the #1 EMR for urgent care year after year, please fill out this form or give us a call, and we'll be happy to schedule a clinician to go through each of the tabs and explain to you why VelociDoc will make your urgent care more efficient and more profitable in less time than you can imagine. Implementing is a snap. Many folks have done it in just a few days. Good luck, take care, hope to see you soon.